Starting here at 11. Good morning, everyone, and welcome to the Compass HIIN May office hours. This month's topic is recognizing nurses and healthcare staff. My name is Sean Laffey, and I am the program specialist for the Compass HIIN team. And thank you again for joining us today. Are you all able to hear me? Okay. A few housekeeping items. If you could take a moment to maybe into the chat, please type who's present today, your name, your facility, and also just remember to take a moment to mute lines and to not place us on hold in order to avoid any on hold music. All right, as the month of May is coming to a close, we can now reflect on celebrating Nurses and Hospital Week from 2018. Every day, nurses and healthcare staff are pivotal leaders in healthcare settings, and it is important to always remember how our caregivers continuously inspire, innovate, and influence. If each of you would maybe like to, for a moment, place something in the chat, ways you recognize your nurses or healthcare staff during Nurses Week or Hospital Week, or even just in general over the course of your experience. Okay, I'll move right into the presentation. Sorry about that. All right, moving into meaningful recognition. Why is meaningful recognition important in the healthcare setting? At an individual and organizational level, research has shown that meaningful recognition has strong positive influence that impacts culture in the healthcare setting. From an individual perspective, meaningful positive feedback is directly associated with one's growth in one's psychological capital. Psychological capital has been linked to a person's well-being, job performance, and job satisfaction, and also confidence and confident outlook towards future situations in their current position. In an impactful role such as nursing, meaningful recognition strongly elevates one's sense of pride regarding their work. From an organizational viewpoint, meaningful recognition focuses on the right that is occurring within the organization. However, a focus on performance improvement is not overlooked. In healthcare, error prevention and creating processes that do not promote workarounds are critical interventions to target. By increasing efforts to prevent mistakes and devoting commitment to recognizing the right that is going on in the organization, this helps create a healthy work environment for staff. How do you engage your healthcare staff? In employee recognition, engagement is essential in creating a positive outlook for that individual or even the group or team. When healthcare staff are committed to your facility's goals and are passionate about their contributions, they are more productive and far less to seek out other opportunities. This, of course, will lead to a lower turnover rate. Regular appreciation and recognition is the best way to encourage engagement and create a positive and productive culture. Why is this? Because a lack of recognition has often been cited as a major reason why workers voluntarily resign their positions in healthcare. Recognizing the value of your healthcare staff. Everyone benefits from clearly defined goals from which to work. Set goals and follow up frequently to reward progress, such as acknowledgement during a meeting or even devising some sort of point system for lunch or other special privileges. Healthcare is emotionally serious work, and taking opportunities to celebrate with with a bit of fun, are excellent ways and opportunities to recognize achievements within your team or goal or team or organization. A thank you is often the most powerful way to show appreciation. These words will tie you and a team together to forge stronger bonds, to strive for specificity, to really connect on recognition. Learn more than a name. Connect more with your staff and have meaningful conversations. Find out about their goals in and out of work, and help to explore ways to achieve their dreams and feel empowered at work. For sense of ownership, when there's an opportunity for improvements and important decisions to be made, allow your staff to participate, and of course, respect their input. This will help the team and of course the individual develop a stronger sense of responsibility and ownership towards their patients. Shared appreciation among peers creates a comfortable culture to thrive in, and it also promotes easier ways to publicly recognize the kindness and accomplishments of others. All right, developing quality competence in the healthcare setting. Your mission and values define your organization. Organizational needs are what your strategic plan is all about. Generally, there are short-term and long-term goals established. Nursing philosophy. Evaluate what your organization's nursing philosophy is. Does your organization have one? Focus on nursing approaches that are within the scope of your philosophy. Examples include nursing roles, nursing interactions, and nursing ethics. Your philosophy must reflect your thought on what you believe to be true about the nursing profession. Investigating nursing theories can provide foundation for philosophy development. When you begin to write your philosophy, engage with your nurses to develop, and then ask, does it align with your strategic plan? Will you have a nursing departmental strategic plan? Developing quality competence. Engagement models give meaning to employees. When you get the doers involved, you get the best products, outcomes, and true active engagement. Keep in mind that when you engage nursing at all levels, you know firsthand the struggles that they are having. You can get innovative ideas by asking them, and you can identify champions who can be utilized to learn more from the evidence to assure evidence-based practices. And it could also aid in training. Nurses want to have rewarding challenges in their practice in order to aid in their lifelong learning endeavors. Continuing with nursing competence, the ability to perform at an expected level, which is competence. This requires a process of lifelong learning. Registered nurses must continually reassess their competencies and identify needs for additional knowledge. Skills, personal growth, and integrative learning experiences. Continuing with quality, nurse involvement is essential to any significant healthcare improvement initiative. Ask yourself, are we following the 6 specific dimensions of healthcare following the Institute of Medicine's updated report? For ensuring safety, avoiding injuries to patients from the care that is intended to help them. Effectiveness, providing services based on scientific evidence to all who could benefit and refraining from providing services to those not likely to benefit, avoiding underuse and overuse. Patient-centered, providing care that is respectful and responsive to the individual patient preferences, needs and values, and ensuring the patient values guide all clinical decisions. Timely, reducing wait times and potentially harmful delays for both those who receive and give care. Efficiency, avoiding waste, administrative and operational, particularly waste of equipment, supplies, and human resources. Equitable, providing care that does not vary in quality because of a person's characteristics such as age, gender, ethnicity, geographic location, or socioeconomic status. Okay, we will actually at this time be moving over to a speaker from Grinnell Regional Medical Center. At this time, I would like to welcome Janet Lacey, the Director of Patient Experience and Quality over at Grinnell Regional Medical Center. And Janet will share what Grinnell has done to recognize employees for nurses and Hospital Week. Janet? Janet, are you available to speak?
Yes, okay.
All right, go ahead.
All right, thank you. We were another nurse from here and I attended the learning community a couple of weeks ago during Hospital Week. And we're talking to Lana and I was complaining because we were missing spa day here at Grinnell Regional Medical Center that we have during Hospital Week. So that's how she asked me to speak today. We have a celebration council here at GRMC that is responsible for planning recognition and fun events all throughout the year. We usually try and do at least one a month. The council's made up of employees from all different departments. And we get together in the fall and plan things for the next year. Lots of times they're just things like cookies or hot chocolate or something like that. And that's when we do our planning for Hospital Week too. That doesn't mean that what we plan in September, we're flexible, things may change, but so we start planning quite a ways ahead of time. Throughout the week, we do special things. On Monday, we received a gift from the hospital. It was not a surprise because we have found out we used to give t-shirts all the time. And then we would alternate. One year we gave t-shirts, one year we did something else. And so some people like t-shirts, some people like the others. So now we offer a choice to all the employees. This year you could get a t-shirt or you could get an insulated mug or you could get a stadium blanket. So you got to choose between those three things. And then Monday of Hospital Week, those were distributed. On Tuesday, we have the spa day that I referred to earlier. And we are very fortunate to have massage therapists on staff here. And on one day a year, they cut back on the amount of outpatients that they give massages to. And they come in and do 10-minute chair massages for the employees. And you can sign up for whatever time works best for you. And then we also have celebration council members involved in that, and they help with hot wax that you put your hands in. And then we do aromatherapy here at the hospital, so you can choose whatever essential oil you feel like you need that day. So that's kind of a fun day that everybody looks forward to. Then on Wednesday, we call it the parish picnic. We have a Dr. Parrish that's retired over 40 years ago from the hospital, and he left some money in a fund that was to be used for a once a year event for employees. So we always try and do that during Hospital Week. And so we have a free meal for everybody on that day, and we call it the parish picnic because that was his name. On Thursday, we have something that staff always gets excited about too. We've been doing I looked up, and for 16 years, we have held a raffle during Hospital Week. And we started this because we were doing a customer service initiative, and we were trying to think of something special that we could do for our patients, that our employees could do as our patients. So we came up with the idea to hold a raffle, and then the proceeds from the raffle would be used to go towards the purchase of an item that's really important for patient care, or something that really improves their comfort, something like that. So what we do is we ask departments, or individuals, whoever wants to donate. We've had volunteers donate to something to the raffle, and then everybody has a chance for about 10 days to buy tickets for the raffle, and then the drawing is on Thursday. This year we raised over $2,300 from our raffle, and we are purchasing a crash cart for the emergency room, and then also a tool called the Wallabit for facilities. Facilities had never been the recipient of anything that we bought, so this is some kind of a tool that connects to your cell or your smartphone, and it will show you where like electrical wiring is, pipes, studs, that type of thing. So they were really thrilled to be a part of that. So this really involves everybody. We had, let's see, I think 19 donations, and the donations have just gotten better every year. Usually they're from departments that get together and do it. So it's kind of a fun thing for the departments to do together. There's just a lot of positives about that. And then on Friday this year, our nurses sponsored a safety education poster contest. And so a lot of the nursing units, I think almost all of them, we had 12 posters, a couple of them did too. And they had education on safety, like hospital-acquired infections, nurse-driven catheter removal, HIPAA, social media, all kinds of different things. So, and then one of the physicians came over and was going to judge which one was best, but she chickened out and couldn't tell us which one was best. So everybody won. She said they were all too good. She couldn't pick that. Also on Thursday, the nursing leadership sponsored an evening meal for nurses. We had it from 5 to 7 so that the day and the night shift could both be a part of that, and presented some special individual nursing awards to people. And then we had so much going on, we actually ran over into the next week, and on Monday of the after hospital week, then we had our Daisy Award for nurses. So we have a very busy week during hospital week.
Certainly sounds like it. It looks like you had a lot of planned events, and everything was working well as a team. I especially liked the raising the money and actually putting that back into your facility. That's absolutely excellent.
Yeah, that's always a lot of fun. We've bought blanket warmers for departments, toys and books for kids in the waiting area. We bought a popcorn machine that we make. We have popcorn like every 2 weeks for employees, visitors, whoever it is. Each departments take turns doing that. So we've bought pulse oximeters, stethoscopes, all kinds of things.
Outstanding, Janet. Again, I'd like to say thank you for taking a moment to share what Grinnell has done to recognize, of course, healthcare staff during Nurses in Hospital Week. Thanks again.
You're welcome.
Okay. Moving along here, available to anyone who wants to also look over some more opportunities to see how to share meaningful recognition to your staff, your healthcare staff, and showing appreciation opportunities for outside of Nurses Week or just in general throughout the whole year. Seeing how you can engage and develop stronger bonds with your staff. Of course, you can also take a look at the information. I'll provide them here on Innovation for anyone who wants to look at them there as well. Moving along to Compass HIIN updates, we'll actually be moving on to some new projects. I do know our opioid guardianship project and, of course, the readmissions refuel are also wrapping up here shortly. So just giving you a heads up for save the dates, we will actually be moving into some new projects. For example, the Swim Towards Stewardship project will be having its informational webinar on Wednesday, June 6th. The Candor Training Series, this will be a 4-part summer training series, and the first one, Communication and Care for the Caregiver, will be on Wednesday, June 13th. Detect Falls, another one of our projects that'll be starting up here shortly. We'll be having its informational webinar on Friday, June 22nd. And just look out for your calendar down the road. Our September HIIN Learning Community will be on Tuesday, September 25th. Again, make sure to always keep an eye out for updates for registration and other events you can attend, of course, through Innovation and any Compass HIIN drumbeats, newsletters, or of course the HIIN Huddle as well towards the middle of the month. To give everyone a heads up for June office hours, our topic will be workplace violence. Data here is collected from 2003 to 2012 by OSHA, and it clearly identifies how healthcare workers have a great occupational risk for violent injuries, and the main source of harm is from interactions with patients. June office hours will be held on Wednesday, June 20th, and I wanted to make sure I give you a heads up on June 20th. This will actually be a week sooner than typical office hours in regards to another presentation the week prior. So just make sure to mark your calendar for that as well. With that, are there any questions in regards to any HIIN updates, upcoming office hours, or of course, the May office hours? I do have a question here for the Falls webinar. I believe it is at 11 o'clock in the morning. I'm not certain on that. I could double check that really quick for you. The informational webinar. I'm sorry, I don't have that offhand. I believe that is 11 o'clock in the morning. I'm sorry. I will make sure Innovation is updated for that, for all correct times and registration links for that as well. All right, if there's no more questions, I'd like to say thanks again for joining us for our May office hours, and I hope you all have a nice day.